Get that set up. Here we go. And as you mentioned, I'm going to talk today about skincare consults that we do for primarily cosmetic treatments, and really how we use this to design sort of a personalized skincare program for each person. So let's see here if I can get that going. There we go. So when people come in and are questioning about, cosmetic care, some people come in for a specific treatment or laser that they've heard about, or some people have a specific issue that bothers them. And a lot of people come in and say, look, I feel younger, and when I look in the mirror, I just don't feel like I should look, or I don't look like I feel, and I want to just feel more rested. So there's a lot of things that people come in with, but what we like to do is kind of go through what happens with aging, kind of discuss the things that occur in our skin, and outline the things that we can do about that. So the way that what we look at this is kind of divided into sort of four things that happen. And as you can see from this sort of split face, as we age, multiple things happen to our skin and to our body. And looking at the face, the first thing that we try to address is what I call the canvas of the skin, or the surface of the skin. And with that, we can see irregular coloration, such as brown spots, red spots, and fine lines and wrinkles. And when we look at that, there's, as Carolyn pointed out earlier, there's multiple things that we can do to kind of address those types of issues. First thing I think that's most important, as practitioners and dermatologists, we want to rule out if there's any other medical issues. You heard about some precancerous spots that we can see, some acne or rosacea, and we try to deal with that obviously first. And once we have, then we kind of look at the skincare. What can we put on the skin? What's the easiest thing that we can do to kind of address some of these problems? And there's preventative skincare, things that we do to prevent these spots from getting worse or occurring, and then restorative treatments. And we'll talk a little bit about that, but creams that we can put on that really can make a difference. And then the third thing, we look at other light sources or energy-based sources, such as lasers, intense pulse lights, broadband light sources, and other types of things that basically can address the brown spots, red spots, and fine lines and wrinkles. And we'll kind of go over those treatments in a bit. The next thing that we look at is sort of the texture of the skin, sort of the little deeper lines, the folds and scars of the skin. And as we age, we see that the lines get deeper, the folds get a little bit deeper. Scars that may have had, even acne scars, actually look a little bit worse as we get older, even though we may not be getting more acne. Sort of the padding in the dermis, or the deeper portion of the skin, the collagen, elastic tissue, and the sugars, the hyaluronic acid that's normally in our skin, we start to lose. And so with these, we talk about a lot of different things that we can do for the texture. If it's fine texture, certainly just skincare, topical products that we can use. Peels that strip off or remove the surface of the skin. Carrie had mentioned neuromodulators, the Botox, the Xeomin, the Dysport, that works for dynamic lines and wrinkles. And then fillers, such as the ones that we use as well, is the hyaluronic acid-based fillers. This is a sugar that's mostly found in our skin. The ones that we use are synthesized, that we can inject and repopulate the skin and the scars. And then obviously lasers. And what we do with lasers primarily to improve textures, we're using these to create wounds in the skin and stimulate a wound healing response so that we get new elastic tissue and collagen to form, and that smooths out the skin. The interesting thing about this is we use them for all different types of scars, whether they're acne scars, lines from sun damage, burn scars, surgical scars. And what's always intriguing to me is when we create these very controlled injuries into the skin and we get this wound healing response, is we see that sometimes thicker scars will soften up and get smoother. We see depressed scars that can fill up and get more even. So it kind of resets the skin and smooths out those surface irregularities. And then the third thing that we look at is, as we age, is we get volume loss, or if we lose a lot of weight, we do a lot of exercise, and we lose a lot of volume. And when we do that, we don't really think about this a lot, but we have fat pads in the skin that give us, a nice sort of rounded face. And when we start to age, we lose that fat pad, and we can see we lose volume in the upper cheek, and that allows the skin to sag and increase the nasolabial fold here, and we get sagging or jowls here. And a lot of this can be corrected by repopulating that volume. And again, we use these fillers, these hyaluronic acid-based fillers, to repopulate that. And that gives us a nice cheek contour and elevates this sort of fold or lax skin. The fillers, as Carrie did a great job talking about, they can last anywhere from 6 months to 2 years. And there can be a little bit of downtime with that, and some risk with that. And then lacks the sort of loss of elasticity and skin sagging, as we talked about. We can use fillers to address that. And then there's some non-invasive treatments, the cell therapy or the Titan. What these devices do is they basically create an injury deep into the skin, stimulate a wound healing response underneath the skin to cause some tightening of the skin. The results of those are modest. We can use them on the face and the neck. Most people that we do it to, they come back and the results are seen in 4 to 6 months, and they say, yeah, my skin feels a little tighter. And we take pictures and you can see a little improvement, but it's not real dramatic. And so if people have a lot of loss to elasticity and volume loss and lax skin, like this picture on the right side or the patient's left side, really you need surgery to address that. And so we can use that as a method to help things as well. And so once we kind of go through with each person and kind of figure out, what bothers them and what kind of things we can address, then we put together a treatment pyramid, and we kind of look at these types of things and put together a plan that we're not only going to do everything on day 1 or the first week, but something that can make a good progress over time. I mean, we're here for the long term. We want to have people that get results that they're happy with and then maintain those results. And so the first thing that we try to address is really, as everybody on this tonight has talked about, is sun protection. And that's really preventative skincare. So before anybody really starts any more invasive or more aggressive treatments, we really want to make sure they're doing the right thing to protect their skin, and that's sun protection. So not only getting, as you heard multiple times, a good sunscreen, which is at least a 30 SPF or sun protection factor, that's broad spectrum, but actually one that you really like to put on, that feels good when you put it on, because if you don't like it, you're not going to put it on. But also, changing your activity, doing more active things outside earlier in the morning, later in the day, wearing broad brim hats and those kind of things. So that's, critical, that as dermatologists, we always, try to stress. And then we look at the next sort of easiest thing to do is what I call restorative skincare. And these are topical products that we can put on, and they actually make a big difference. And in doing them long term, you can see a very significant improvement. I've been in practice long enough, so I've seen people that have used good skincare for decades, and they get really dramatic results. You can see a big difference if you do things consistently. We kind of talk about it like going to the gym. You want to get in shape. You don't just go 1 day a year and you get in shape and you're good for the rest of the year. But if you go, regularly, a couple times a week and do a little bit, it makes a big difference. And that's the same thing with skincare. So we have products that help with improved tone and texture, such as the retinols or retinoids, skin lighteners that help with pigmentations. Some other products that have antioxidants and peptides in them that also help with skin tone and texture. And so we kind of put together a plan for the person based on that. That should be a long-term, easy plan. Now, in our practice, we see a variety of people. There are still, with people that are pretty motivated, very few people that can do a 7 to 10 step regime of topical skincare. It's very hard to keep that up. So we try to make it very easy, a 2 or 3 step program that people can do on a daily basis. And then we look at restorative treatments. So here we start looking at skin pens, peels, lasers, ultrasound, and other energy-based modalities to address those conditions that we talked about, the pigmentation, the redness, the fine lines and wrinkles, the scars. And we put together a plan that makes sense. And part of this is explaining what kind of results we can get, what the downtime is, and what the risks are that we go through when we do these treatments, because there's always risks. for specific lines of muscular expression, as Carolyn mentioned, the glabellar lines, the crow's feet around the eyes, we use neuromodulators. These were phenomenal. It's the most common cosmetic procedure performed in the world and very, very safe. It's rare that we have complications, but not impossible. And so we go through that type of treatment. And then certainly we talked about the fillers. Again, probably the second most common procedure that's done to recreate that volume and lift. And then there are some people where we can do some of these or several of these, but they're not going to do the job. And so they really need some type of surgical intervention. And we have colleagues that specialize in eyelid surgery or facelift surgery that we can refer to. So just to kind of highlight some of those things, this is two twins. It's from a famous twin study that was done over a period of years. And these twins lived in different geographies of the country. And you can see the woman on our right side obviously had a lot of sun exposure, and the woman on the left had very little. And this is without any intervention. You can see the significant changes that we see just with sun exposure, the fine lines and wrinkles, the pigmentation, the laxity of the skin, this type of loss of tone. So a lot of changes just from sun protection. And that's, again, why we kind of harp on that so much, because it makes a big difference. And this is from another study from a friend of mine, Dr. Tangeti, who was studying the use of a retinoid. This is a woman that had no laser or peels or skin pen intervention. All she was using was a topical retinoid. And you can see the significant improvement in the tone of her skin, improvement in the fine lines and in the pigmentation. And so oftentimes, if people haven't been on a good skincare program and they come in and want to have laser, we'll say, well, look, let's start with a skincare program. Give it 6-8 weeks, see how you're doing. And some people come back and they're seeing improvement and they decide they're going to hold off on the laser treatment. I love doing laser treatments, but sometimes it's not something that we just jump to. And there's a lot of things that we can do with using a consistently good skincare program, as you can see here. This is a woman with redness, and she, you could say she has erythrogenic rosacea, but the treatment is the same. And this was treated with a pulse dye laser. This is her on the left before treatment. The nice thing about these lasers now is this immediately after. People get a little more redness and swelling for a couple hours to a couple days, rarely longer. And then after 2 treatments, you can see the significant improvement. And so we use a couple different lasers to treat this. It works excellent. Probably the most common thing that we do. There was a question about Mirvaso, and there's another, Rofade. These are topical creams that vasoconstrict the vessels. So they're used as on a daily basis to constrict the vessels. And I agree with Dr. Sellinger. Oftentimes, it can look a little ghostly sometimes, and you can get some rebound flares. And so generally, I'm not a huge fan of those because I know how well that the lasers work. We can use intense pulse lights or broadband lights. These are not lasers, but they're light sources that do address redness. It's basically what a laser is a device that has a specific wavelength that targets a very specific target, like the redness in the blood vessels. An IPL or BBL is a flash lamp, and we put filters in that to get a series of wavelengths of light, a lot of light. Some of it may address the redness. So it's a good device. I kind of think of it as a jack of all trades, master of none, whereas a laser is one that is very specific for a particular condition. And this is a woman that has some photo aging, the fine lines and texture of her skin. And this is after an ablative fractional laser. And what this laser does is it pokes little holes in the skin, like you have your lawn aerated, creates a wound, and then that wound heals up. And with that, you get improvement in the texture. With this one, there is a bit of a downtime with it. There's milder ones that have less downtime. Our goal with these types of lasers is to get 30 to 50% improvement, in the fine lines or texture, and that can take anywhere from 1 to 3 treatments with that. And then lastly, as we talked a lot about fillers, this is a picture of somebody kind of before the fillers. You can see the accentuation of her jowl and her nasal fold, and afterwards, it's a natural look, softens this up and kind of helps with the full, with that. So many times when we put together a program, we use multiple modalities. It's not just one thing for one person. And you can see we can have dramatic results from a cosmetic standpoint using these and depending on what each person wants and is looking for. So with that, that's our treatment pyramid once more. And I think I'll conclude and have probably time for a few questions if there are any. Let's see. Okay, here's I got one here. Does laser help milia? Milia are small little superficial cysts, and generally the lasers are not needed. You could use a laser to treat a milia, but there's much easier and less costly ways to take care of those. Let's see. Here's one. When I think of skincare, I really only want to use non-toxic products. Oops, let's see. Does your clinic carry such of those products? Yes, we get those questions a lot, and we do, we hope that all of our products are non-toxic, and it kind of depends what each person's definition of that is. A lot of people want botanicals, poison ivy is a botanical and that can be toxic to somebody. But basically the products that we have, we try to get products that are more naturally oriented, that are non-animal tested, and basically kind of fit in that realm. It's interesting. I worked with Aveda for a long time with the founder Horst, and obviously he was one of the leaders into that foray of natural and organic products, and we definitely are pushing in that direction. But it was interesting, even when working with him for so many years, there are certain active ingredients that are just really good, and it's hard to get a replacement that's sort of a natural organic ingredient that does the same thing. One example is hydroquinone. Hydroquinone is a lightening agent that is really the best topical lightening agent that we have, but it does have potential toxicity, and it's not something that we use for long term. There are many other types of lightening ingredients that we use, but they just don't work as good as the hydroquinone. But for certain people that don't want that, we have alternatives. So that's a great question, and we wrestle with that all the time. Let's see, who can I schedule an appointment to come in with my treatment plan, and what is it? So generally in our clinic, it's just a consultation, a cosmetic consultation, and then you meet with us and we kind of go through that program with you. This is a great question. What's the best treatment for extra neck skin? Really the best treatment to get results is a lower facelift. We've worked a lot with Ulthera, with Titan, and even ablative lasers that we've used on the neck, and you can get maybe a little bit of tightening, but for most people, when they talk about that, if you take your fingers and kind of move them up your jawline, people move that skin up probably, 1 to 2 inches, and there's no way a non-invasive device is going to get that kind of improvement. Now, there are a couple companies, 2 companies that are looking at ways that are minimally invasive that would potentially address that. There's a company called Erectros Medica, which is actually was founded by the founder of Thermage, if you remember that sort of tightening device. And what it does is, it's pretty unique, is it takes small little biopsies or tiny little biopsies of skin, kind of like the laser does, but then they bandage it up and they remove a bunch of little spots under the neck. And then when it heals up, they can get some tightening and some improvement. And so that's, they're in their clinical studies now. So there may be something that we can do that's better than these non-invasive treatments. It's got a little more downtime, but certainly would be less aggressive than a facelift. So keep tuned to that. Neck, yeah, a lot of questions about neck. So we do fractionated laser treatments. We do the Titan, we do Ulthera on the necks, and we get some improvement skincare, but it kind of depends on, what we're addressing there. Here's a question about Ultherapy. We talked about that. That's basically, it's an ultrasound device that basically focuses the energy of the ultrasound into the deeper layers of the skin, and it creates small little zones of injury, lays down a bunch of them deeper into the skin, and when that heals up, you get some tightening and improvement. It is the only device that is FDA cleared for lower face tightening. It also has approval for brow lifting, and we kind of use it for that. It's about a 45-minute procedure. It's a bit uncomfortable. You have some redness and swelling afterwards for a couple days to a week or so, rarely get some bruising. And then we see the results sort of, 3, 4, or 5 months later, where you slowly get some improvement and some tightening in the skin. What was used? Yeah, that woman on the last slide, she had a facelift. So she had a facelift plus a skin resurfacing procedure. So that neck improvement you saw on the jawline was primarily due to the facelift. What laser performed the most? Is there a relation overall for good? Yeah. So that's a great question. And from a volume standpoint, in Minnesota, we probably do mostly treatment for redness. So I use 2 lasers for that, a KTP and a pulse dye, but there's a lot of lasers that we can use for that. And probably for skin tone and texture, we either use an ablative fractionated resurfacing, or we have really a nice treatment that's a combination of a laser that targets pigment and then one that does a superficial resurfacing on the skin. So it's pretty easy to go through, and you have a sunburn reaction for about a week. It's called the Q-switch Alex dual treatment. It's one of the Fraxel devices, and that works quite well. What is your opinion, efficacy of plant-based retinoids? Yeah, we've played with those a lot. I think they're not as, a lot of retinoids aren't very stable, number one, and I think the best ones are, from an efficacy standpoint, are the synthetic ones that we're using. Let's see, do tools like NuFace do anything beneficial? That's a great question. I think they do. I think they have to be used correctly, and it's kind of like skincare. What some of these devices do is they create a little bit of a wound. I think the NuFace may have a couple different modalities, but we've done a lot of work early on in my career. We were doing a lot of work looking at how the skin healed, and we were doing skin or tape stripping on the skin. So we would put cellophane tape, Scotch tape on the skin and kind of peel it off. And it would just peel off this very superficial layer of what we call the stratum corneum, or the dead layer of the skin. And we did this over time, and then took biopsies and kind of looked to see what would happen. And we were kind of measuring how quick the skin turned over. And it was really interesting because what we noticed is that when we did it on sun-damaged skin, it actually would normalize or thicken the epidermis, the top layer of skin, where usually that's very thin. So it had a regulatory effect to say, hey, look at, we're being a little injured, we need to step things up, and it thickened up the top of the skin. But another thing that we found, which was really interesting, is that when we stained for collagen fibers in the skin, it actually got some new collagen that was developed in the very superficial dermis. So we call it the Three Stooges effect. We would damage the stratum corneum, that would create a response in the epidermis, which would then create a response in the dermis. So some of these things that may seem kind of trivial, if you do it consistently and not too aggressive about it, you can get some improvement. So it's kind of interesting on that. Let's see. Thoughts on skin pen? Again, that's kind of another way to injure the skin. What we try to do with a lot of these lasers is to create a wound. And what we want to do is create the biggest wound we can to stimulate the biggest wound healing response that will give us the most improvement, or the most collagen elastic tissue. But we don't want to make it too big that it leads to a scar. So it's kind of a balance of creating a big enough wound to get the most response, and one that heals up quick and doesn't give us a scar. So the way I kind of look at this is with a skin pen, we're taking basically a little pin and just poking it into the skin multiple times. There's many different types of pens out there that go deeper than others, and you can adjust them a little bit. And what that can do is you can create a minimal injury. And as Carrie mentioned, you can do a series of those, and over time you can see some improvement. The difference between that and say a laser, we have non-fractionated, we have non-ablative fractionated lasers and ablative ones. The non-ablative ones basically create a thermal zone of heat. So it creates a column of heat in the tissue. It doesn't remove anything, but it heats up a volume of tissue. And that's a bigger wound than just a skin and a pinprick. So I think we get a little bit more wound healing response and a little better results. And then we have the ablative fractionated treatments that actually the laser bores a hole, it vaporizes a column of tissue, creates heat around there. So you're not only removing skin, but you're creating another injury with heat. And so that's a bigger wound that creates a bigger wound healing response, and you get a little bit more improvement with that.